Good morning, everyone. I am Palumayan, a student from the De La Salle University, Laguna campus. And today, I would like to inform you guys how today's technology helped our medical frontliners combat the virus and give aid to others during the COVID-19 pandemic. I am sure that during the pandemic, most of us received the news regarding the status of the world in our community from the use of technology. From receiving news about the schedules of lockdowns to the total data that was garnered from the virus, like how much more daily cases we have, total number of infected people, number of people that recovered from the virus, and mortality. But how big of a difference did technology have in helping our medical frontliners combat the spread of the COVID-19 virus? Technology has helped our medical frontliners more than we think. With the social distancing guidelines that were implemented because of the virus, hospitals are encouraging people to have remote consultations or virtual online consultations instead of going to the hospital. Being able to reach out to the patients even though it is virtual is a better option opposed to seeing them in person and risking the medical frontliner and the patient to contract the virus and making them more susceptible to spread the virus. Hospitals have always been packed with patients. By using technology, doctors, nurses, and hospital employees were able to have a more organized staff management, patient management, lab management, equipment management, and inventory management by having a proper system for these areas. Hospital employees can oversee what needs to be done in the hospital to give their patients the best care for them to be able to recover from the virus. Another beneficial use of technology during the pandemic is the ability for people to schedule testing for the virus as well as vaccination. As the saying goes, prevention is better than cure. Preventing ourselves from contracting the virus is already a big help to our medical frontliners since we are one less patient that they must monitor and care for in the hospital. Another beneficial use of technology to our medical frontliners is in one of the equipments that they are using to provide care for their patients, the X-ray. Having an X-ray is essential during these times because the X-ray can help identify if the COVID patient has pneumonia or not. Having pneumonia while having the COVID-19 virus is deadly because it would result to the patient having difficulty in breathing, which is why some patients die because of the virus. Another piece of equipment from our frontliners is the ventilator. Having difficulty in breathing is deadly when you are infected with the virus. So doctors administer you with a ventilator. Ventilators help patients breathe since the equipment pushes air into and out your lungs. Sadly, this equipment is not always available at every hospital, and whenever a hospital has it, they only have a few units as well as it is costly to use. Another piece of equipment that our frontliners use is oximeters. Oximeters are essential because they monitor your blood's oxygen levels as well as give quick readings so that the medical frontliner has less exposure time to the infected patient. Oxygen levels are important especially when you have the virus because low oxygen levels are fatal especially when you have COVID, more so when you have a comorbidity like obesity and high blood. Another piece of equipment that our frontliners use is the digital thermometer. Digital thermometers also give quick and accurate readings for our frontliner again to have less exposure to the infected patient while still being able to monitor them thoroughly. Last but not the least is for emotional support. Our medical frontliners have families of their own too, and it is such a heartbreaking experience for them to choose to stay away from them and keep their family safe by not seeing them, not sharing meals with them, and not feeling their presence. With the help of technology such as social media, our medical frontliners were given the chance to see their families and loved ones despite not being present at the moment. Having technology on our side to help us fight the COVID-19 virus is truly a great relief. These are only a few examples of how technology has helped our medical frontliners during the pandemic. We should not only thank our medical frontliners, but our frontliners in general for helping us even though they know what the virus is capable of. Always remember, please get tested and vaccinated, always wear a mask, observe social distancing, and as much as possible, stay at home. Thank you, frontliners, and thank you everyone for listening.